Scotland. So, Henry, the platform is yours.
Thank you, Terry, and thanks for the kind words. I just want to start by congratulating Tom and Terry, and indeed all the partners that have brought this together. It's wonderful to see so many of you here. It's a real honour and a privilege for me to have an opportunity to talk to you today and just to share some of our thoughts. But huge congratulations to you all for bringing this together. It's wonderful. And I suppose the appetite for collaboration in Scotland is second to none. And I'd like to cover a few areas with you this morning. I've got about 15 minutes, and for those of you who probably know me, I could talk for like a lot longer than that, and someone will remind me that, to stop. But just to begin with, I think on that theme of collaboration, and going back to the early days when we actually brought the Scottish Dementia Research Consortium together, and as Terry says, the consortium is hosted within Alzheimer Scotland's legal and governance framework, but obviously has its own identity and agenda, but we've obviously worked very closely together. But one of the reasons that we were keen to set the consortium up was to demonstrate the ability of collaboration in Scotland, and also to help those leading academics and researchers just remove the sort of cloak of their own institution and bring Scotland together as if you like, an entity and a community. And back then, one of the first things that we did was took a delegation of some of our top researchers and academics down to the UK government to meet with the new ministers. And indeed, Frank's here, but that also included Professor John Starr, Bettina Platt, Jean Manson. And we met with the government then, and we were really keen to tell them how progressive Scotland was and how much we wanted to engage in that agenda that was being set at that time by David Cameron and the Conservative government. And we got a lot of promises, and we were actually getting told we'd have seats at the table. And I'm really sad to say that after so long, I don't think that has really materialised. And I also think that Scotland has to perhaps reimagine our position in terms of UK and dementia research. Because I look around this room, I look at the partners who are here, I look at the Scottish Dementia Working Group and the National Dementia Carers Action Network, and indeed the partners in research programmes, and I look at the abilities that we've got. And my feeling is that we are so progressive, we've got such a lot of talent, we have such a lot of ability, but we're not getting a fair slice of the pie. And in fact, I feel rather frustrated that after all the years from the initial meetings, that we're still having to partner in proposals, partner in bids. I know recently there's been numbers of applications, and some have been successful, and I know colleagues here are engaged in discussions. But quite frankly, I don't think that's the future for our dementia research community in Scotland. I don't think we're getting a fair share. And whilst I really recognise the value of what's been done just now, and I really would take my hat off to some of our colleagues down south and what they've achieved, I've personally spent many years sitting in board meetings and committees, particularly around about joint dementia research, trying to get Scotland's needs, strengths, talents and abilities understood. In a 4-hour meeting, we're lucky if we get 2 or 3 minutes. And we're lucky if we can get Scotland put into a context here that understands our needs and our skills. I don't think that's the way forward. And I have to tell you, I'm sure you'll probably agree, it's time for us to get a bit frustrated about this, isn't it? It's time for us to get a bit angry. It's time for us to push our elbows out and say, hey, wait a minute, we've got a lot of ability here, we've got a lot of talent. Don't just include us as a small part of whatever bids are coming forward. Give us the right resources to do the work that we can. And I believe that we should go back to what we did originally, which was actually go down and meet with the new government and talk about our abilities and talk about our strengths, because now we're more than 10 years on with that. We're even stronger. We've got such a lot to offer. I mean, we have things at our disposal. We've got the Edinburgh Consensus. We've done lots of work in terms of the St Andrews groups. We've got, the network. We've got wonderful engagement in terms of people with lived experience. But we've also got the first walk-in brain health clinic anywhere in Europe. We've also got the first brain health and dementia strategy that was really in play. And for 4 or 5 years, we've been at the front end of all of this work. We've got some of the best research when it comes to practice. We've got some of the best focus in terms of not just looking at the pharmacological side of dementia care, but we're looking at all aspects of it. Many of the researchers are here today. We have a lot to offer. And we need to go and negotiate that. We need to go and put Scotland PLC on the map. We need to make sure that people understand that Scotland is more than just a small junior partner that can get a little bit of whatever the big plans that we made down in the sort of the London area is. So I would like to move on from today with a commitment from everyone to actually go down, meet with the new government, whoever they may be, meet with them, talk to them, and start to get a better deal for Scotland in this context. It's essential that we do, because if we don't, I think that we're just losing the opportunities of all the strengths that we've got. And I also do not think Scotland should be at the back of the queue when it comes to new forms of funding and new forms of research. We've tried really hard to engage, and I know some of us were invited down to the number 10 recently, and Tom and I were certainly there. And it was so obvious that there's some great work being done, but getting Scotland's focus on that has just not been strong enough. So that's one thing and one area I think we really must move forward on, and Alzheimer Scotland will be committed to supporting that, and we'll work closely with, obviously, all the partners who are here today. The other areas I think that we have to really be thinking about, colleagues, is, and I know there's a lot of discussion, and it's always a feature of when we talk about research, is the fact that research brings hope. There's no doubt about that. And you are the custodians of that hope. You are responsible for generating and developing that hope. And indeed, colleagues, we stand on the shoulders of giants who have gone before us that have created that platform. But I am deeply, deeply concerned that what might happen in Scotland is that we actually find ourselves in a position in the coming months where there will be a tsunami of hope when we hear about the new drugs and we hear about the new approaches, we hear about lecanemab. And then just like any tsunami, when that comes flooding back out, there'll be a world of isolation and despair and frustration and potentially anger and indeed a loss of hope. And that is a real issue and something we must prepare for. Now, I know that's not necessarily just all about research, but research is taking us there. And if you imagine what we're going to have to go through, thousands of people in Scotland, when they hear about lecanemab and we hear the announcements in the coming months, will be hopeful that that might be something for them, something for their family, and indeed will do everything that they can to try and access that. Now, just imagine what that would be like for you. Imagine the circumstances that you would find yourself in there. And then imagine having to hear, well, actually, in Scotland, we might have to wait to find out what happens with NICE. We then might need to wait to find out what the Scottish Medicine Consortium says. And then we'll have to wait to find out what each NHS board says. We could be sitting here in 2 or 3 years' time with a community that actually isn't full of hope, but is full of despair. Now, we can't let that happen. We have to try and press our government and indeed our policymakers to understand that the opportunities that are coming, they might not be perfect. No one's saying it's perfect, but they are the essential step to the next stage. And we have to ensure that people within Scotland are able to access the relevant trials, the relevant studies, the relevant blood-based biomarkers, again, not as a second thought, but as an equal partner in this whole process. We are part of it, and we shouldn't have to wait. And the people that we represent, and the people who we're going to have to fight for shouldn't have to wait at the end of the queue for this. And we can work together to define what's required. We know we're not ready for it. We know we need better scans. We know we need to use new blood-based biomarkers. We know we've got so much to do. But let's get our agenda and all our ducks in a row and be clear as to what we want, so we can communicate to people that we're doing that and that we're on their side and that we're going to make this possible. Where possible. It might not be that we can get it done as quickly as we would like, but we've got to try. We've got to try. And colleagues, one of the things that you will have probably heard us speak about before, indeed, I know, certainly I've done a lot of work with Tom and the network in this, but one of the things that we can do in Scotland is we can reach people in a different way. And we understand, I believe, people, and we understand the communities in Scotland far better than many of the policymakers and indeed the pharmacological companies who have a view about how we recruit people to research and have a view of what the sort of main types of policy should be in that area, which in my opinion is entirely wrong. If they would listen to us and listen to what we can do, we can reach in to the hearts of communities who don't quite understand the value of research yet because we don't have the conversations with them about it. Every day we have got colleagues, many of our 300, 400 staff talking to people about research, and we get fed back that it doesn't really mean a lot to people. We hear that I'm struggling just to get through the day. I'm waiting to get a diagnosis. I'm waiting to get a community care assessment. Research just falls down that agenda. And that's something we can do a lot about. We can inspire people. We can bring people on with us. We can engage people. We can build up the most diverse, inclusive research range of volunteers anywhere in the world and make Scotland a country where research investment is worth it because we've built that infrastructure. We've put the scaffolding around about the potential, and then we bring in the funds. But again, we need to get that done in a way that puts Scotland at the forefront. We put our elbows out and we build in our ability. So I'm just going to check the time. So 2 minutes left. Yep. Right, that's great. Thanks very much. So colleagues, from that perspective, we also have other challenges. And one of the things from my very clear position here is that we're not going to build up a range of research volunteers. We're not going to argue and campaign to get new drugs and new discovery coming to Scotland without challenging how much costs there are associated with that and the profit that some of these companies are looking set to make because of what they're going to ask to be paid for some of these drugs. That's not right, because there's not a single drug being developed that they will profit from that has not involved some volunteer who's been willing to put themselves through a research programme for the benefit of individuals coming behind them. And that is not something that they've done so somebody else can make a profit from it. Profit's fine, but it has to be reasonable, and it has to come along with investment to support that infrastructure and to support the absolute legacy of those individuals that made that contribution. So when we hear costs like £30,000 a year, and we hear, the ludicrous figures that we're hearing, we have to stand up and say, that's not right, that's not fair. You wouldn't be here without people having given the commitment to research to take us to this stage. So come on, be fair with us, be reasonable, and we will not build up a network of people and volunteers and support that conversation unless we get a fair deal in both fronts. A fair deal from the companies, a fair deal from the government, and we get listened to understand what the strengths that we've got in Scotland are and take that forward. So, colleagues, let's keep our belief, let's keep our hope, let's be the custodians of that hope, but let's work together to transform the way that we in Scotland are perceived, are treated, and are absolutely funded and given the right level of commitment to allow us to do what we've got the ability to do. It's time. It's time now to get a new start, and it's time now to really move forward. And I look forward to working with you all, and indeed with the consortium and all the partners, to hopefully achieve much better progress over the next 10 years, and making sure that people in Scotland don't lose hope, but they have faith and they have belief, and they support us to achieve what we need to do. So thank you very much, and I wish the conference a great success today. Thank you.
Okay, so you heard it here first. Westminster, we're coming for you. So I mean, I think what you get from Henry's rallying call there is that there's something for us all to do, and whether we're in this room as a researcher, as a clinician, as someone living with dementia, or as someone working in third sector or policy, you know, that there's work for us all to do. So we're going to move from that opening address into the main conference now. There's a little bit of housekeeping that I need to share with you. For those of you who enjoy dabbling in social media, on the platform known as X, you can use the hashtag Scottish Research 2024 to share your thoughts. We will be doing questions in two ways. So we will have a roving mic, but we also have Slido, and the Slido code will come up when we open for questions. Just like yesterday, we have crammed so much into today, it's almost at critical mass. So we will be asking all of our speakers to keep to time, and you may get the bell if you go over time. I'll just remind people to have a look at our posters over on the wall there, and have a look at our exhibitors at the back. And with that, we'll move on to the next session. So while we're always about breaking